Hi guys, Jeff here. So this is EMR. This is what we're gonna try to do here. See how this works out. We're in chapter 18. We're talking shock and bleeds, and I just wanted to kind of cover some of the material with you guys to finish up this chapter. So we're going to talk about special situations. Normally in class, I'd have you guys take notes. Reality is that's not really truly necessary now because you'll have this video with you if you want to go back over these pieces. I Please bear with me if the lights go out. I'm still here. There's nobody moving around in class, so it just shuts off for me just like that. So let's see if we can get this done here, okay? So basically, we're talking about special situations. Let me clean off my screen. So when we're talking about bleeds and shock, we're talking about all sorts of different types of situations. As you can see, we have a situation here. We have somebody who's lying flat, prone on the ground. Oxygen is flowing. We all know that shock is what kills us, right? It's a thing we need to identify as quick as we possibly can. Reason this person is lying flat. This is the best position to allow the body to work easily to circulate blood throughout the body, providing oxygen in this case because we're trying to make sure that we have everything oxygenated appropriately for the patient, being that they're lacking circulation, the heart may not be functioning properly, so we're aiding the body, adding a little extra to it. Nosebleeds. How many of you guys have ever had a nosebleed before? Quick little story. We had a guy, I think I told you once before. I was on a school bus. Of all things, he's wearing a white jumpsuit. Don't know why. When we got on the bus, there was blood everywhere. You could smell it. It was old, dried blood all over the place. Luckily, all the kids were off the bus. But the school bus driver was blowing his nose and throwing the blood all over the place. And we told him, you need to pinch your nose. So finally, after back and forth discussing this with him, he finally decides to pinch his nose. And while he's pinching his nose, he says, but how am I supposed to breathe? Some people are just morons. I don't know. So with a nosebleed, things that could lead to this, some medications we take could actually kind of dry your sinuses out, which is going to lead to cracking and breaking open of blood vessels. Altered mental status could be something that persists with this. If we lose too much blood, seems unusual to lose a lot of blood through a nosebleed to cause this situation, but it could be part of the problem. It could lead to that AMS. Nausea, vomiting is going to be a concern. This causes airway compromise, and important for us to remember that. Really, what we're doing here with a nosebleed, especially with younger people, it's pinch the nose, lean forward, never back, because by leaning back, you're allowing that blood to drip into your airway, also down to your stomach. And that leads us to eventually nausea, vomiting. If nausea, vomiting is going to happen, again, we've got an airway compromise issue. So by pinching the nose, we just stop that blood flow altogether, and that's a good thing. So here you go, treating the nosebleed upright or slightly forward. Pinch the nostrils together. A cold pack can be placed bridge of the nose between the eyes. I've heard behind the back of the neck, which is kind of seems odd, but if you think about it, we're placing that cold compress, which is constricting blood vessels that are going into your head. So that's a good way to kind of slow things down. Avoid, and you can see I'm in the way here. Sorry. Avoid nosebleeds or no blowing nose. Excuse me. Avoid blowing nose, like we just talked about. We need to allow it to clot. If it's not going to clot, we can't stop the bleed from happening. This is a challenge. Sometimes people really do want to actually blow their nose. They get to feel that pressure in there and the need to get rid of things. It's got to stay in place. The only way this nosebleed is going to stop is if we actually get that clotting factor to actually happen. Internal bleeding, focus on facilitating rapid transport. Apply oxygen like always. We need to get a little extra. Stop additional external bleeds. So in this respect, we identify if we're looking at internal bleeds. Now this would be bruising that we see on the outside, and we see actual trauma mechanism of injury that would lead us to suspecting internal bleeding. If you had a fracture of the femur, large bone in the upper portion of the leg, that would be painful. It would be, you'd see an angulation, you'd see deformity. But if you see rapid swelling, then we've lacerated that femoral artery, which is bleeding into that tissue. If you were to look at the abdomen again, we see some bruising around the abdomen, especially the upper quadrants, and we understand this now, right? These are the typically we're going to find the solid organs full of blood. So if we find those that bruising or rigidity and guarding or painful on palpation in those areas, we need to assume internal bleeding in that respect is rapid transport. Apply that oxygen, stop additional external bleeds if we have them and we need to. That's it. Okay, just those couple of slides talking about those special situations. We are going to come back again at a later date and look at emergency care for shock, overall what we would do, what we've done in the past, what works well and what doesn't. So with this lecture, I'm going to put up a couple of questions to follow that I'd love for you guys to go through and answer. You have access to the video and content, and you've got your notes and other stuff. Plus, we've got the ability to do some research online and stuff like that. Remember the acronym KISS. Keep it simple, stupid. Okay, that's what we're going to be working with right now. This is a very unusual situation we're in, and I think we're going to make the best of it. I appreciate you guys being here and being involved, and thank you. Okay, I'll talk to you later. Bye.